everyone, and welcome to Mental Health Education. My name is Jessica, and I'm a medical student who believes in the power of education. I hope that through these videos, we will end some misunderstandings and/or fears about mental health. As a reminder, these videos should never be taken as medical advice. Please speak to your providers if you are in need of treatment for any type of illness. Today, we will be diving deeper into the illness known as schizoaffective disorder. Before you watch this video, I do recommend that you watch my overview video on mood disorders, overview video on psychotic disorders, and schizophrenia in order to have a better understanding. Our case example is a 47-year-old female presents to her psychiatrist's office for her routine visit. The patient is accompanied by her sister. The patient has been under the care of this psychiatrist since she first started showing signs of mental illness when she was 26. When the patient first presented for treatment over 20 years ago, she was brought to the ED by the police. Her family had sent out a missing person search and she was found wandering the streets 2 towns over. At that time, she had, over the course of 9 months, developed many symptoms of mental illness. She had lost many of her social skills, concentration abilities, and motivation. She had started hearing voices and struggling with disorganized speech. 1 month after she started hearing the voices, it felt like her body gave up. During this time, she was barely able to get out of bed, was constantly tired but couldn't sleep, had lost 7 pounds, couldn't find joy in any activity she used to like, and felt depressed and hopeless. On top of it all, she could still hear the voices, even louder now, telling her she was a burden on her family and that she should find a new home away from them. That is when she started wandering the streets. Over the past 20 years, the patient has been in the psychiatric hospital 3 times. Each time, she has stopped taking her medications and going to therapy, and quickly her symptoms of mental illness returned. She, however, has been very good with taking her medications for the past 7 years, is stably living with her sister, and just started working part-time on a farm taking care of animals. She loves music and feels understood when she listens to many musicians' struggles. She has developed more trust in her psychiatrist over the years and does not have any immediate complaints today. Our patient has likely been diagnosed with the illness known as schizoaffective disorder, with a specifier of the depressed type. This disorder can be challenging to diagnose, as patients with this illness suffer from symptoms of both a mood disorder and schizophrenia. Throughout this video, we will talk through the criteria needed to diagnose this disorder, and hopefully by the end, it will be clear how her symptoms fit the picture. As always, it is important for doctors to rule out the possibility of the symptoms being caused by substances and/or other medications. Doctors must also always wonder if the symptoms could be due to other medical and/or psychiatric conditions. The National Alliance on Mental Illness reports that schizoaffective disorder is a relatively rare disease. There are many criteria that must be met in order to diagnose schizoaffective disorder. Please see them listed here. Let's walk through this together. There must be a period of the illness during which there is a major mood episode, this either being mania or a depressive period, in addition to the criteria for schizophrenia. The criteria for schizophrenia includes that the patient must suffer 2 or more of the following symptoms for 1 month, with at least one of the symptoms being the first, second, or third listed: delusions, hallucinations, disorganized speech, grossly disorganized or catatonic behavior, and negative symptoms. The patient must also have hallucinations and delusions for 2 or more weeks in the absence of a major mood episode during the entire lifetime duration of the illness. The symptoms of a mood episode must, however, be present for the majority of the total duration of the active as well as the residual portions of the illness. A very simplified way of explaining this disorder would be that patients need to have a period of time where they have depressive or manic symptoms and psychotic symptoms, and then also a separate, distinct period of time where they only have psychotic symptoms without any mood issues. Please see my overview video for mood disorders, overview video on psychotic disorders, and schizophrenia for some important definitions. The disturbance must also not be the result of the effects of a substance such as a drug or medication or another underlying medical/psychiatric condition. As mentioned earlier, there are specifiers for this illness. These just help doctors to further zone in on the symptoms the patient is suffering from. Bipolar type includes episodes of mania and sometimes major depression. Depressive type, however, only includes major depressive episodes. Understanding all the steps towards making this diagnosis can be a little tricky, so let's walk through some things briefly again together. Mood disorders include diseases such as bipolar type 1, commonly called bipolar disorder, and major depressive disorder, commonly called depression. Patients with bipolar have episodes of mania and then sometimes have episodes of depression, though having a depressive episode is not needed to make this diagnosis. Patients with depression have episodes of depression. There is also a category of disorders called psychotic disorders, and these patients suffer from symptoms of psychosis, along with other categories of symptoms. Some of the classic symptoms of psychosis that we think about are hallucinations and/or delusions. Remember, a delusion is a fixed false belief that the patient cannot be convinced is untrue, even if evidence is presented to them. Under the broad category of psychotic disorders is a disease known as schizophrenia. Patients with schizophrenia tend to go through three phases in the disorder: a prodromal phase, which is where symptoms are first starting to present, an active phase, which is where patients have strong symptoms such as hallucinations and delusions, and then a residual phase, which is where the symptoms start to lighten, but the patient may still have issues with memory or concentration. Patients with schizoaffective disorder have symptoms of both a mood disorder and schizophrenia. The patient must have a period of time where they are suffering from a mood issue, that being mania or depression, and at the same time meet portion of criteria for schizophrenia. The specifiers of either bipolar or depressive type speak to the mood issue the patient is suffering from. They must also have a separate, distinct period of time where they have hallucinations and/or delusions in the absence of a major mood episode, meaning they have psychotic symptoms at that point, but no issue with their mood. Remember, though, during the majority of the active and residual portions of their illness, they do need to meet the criteria for a major mood episode. That was a lot of information, and yet again, this is a simplified view of this disorder, but I encourage you to watch the other videos or click on the links below for more information. The cause of this disorder is still unknown, but it is believed to be a combination of genetics and environmental factors. Receiving this diagnosis can be very challenging for both patients and their loved ones. People should know, however, that there are treatments available and providers who can be there for you every step of the way. Lifestyle modification should always be explored with patients, such as exercising and eating a balanced diet. Hobbies that are excellent for these patients include art, music, gardening, and working with animals, as it can help them connect to their external worlds. Therapy is crucial for these patients and their loved ones. Family therapy, skills therapy, which is where patients learn work and social skills, and of course, talk therapy is available. It is important for patients and their loved ones to remember that they are not alone with this illness and that there are professionals that can help with the processing of emotions. Medications are also very important for these patients. Most of these patients will be on more than one psychiatric medications. These could possibly include antipsychotics, mood stabilizers, and/or antidepressants. As always, providers will weigh the risks and benefits of starting any treatment. At the end of the day, the most important thing for people is to receive the treatments and proper care they deserve. If anyone you know, including yourself, is suffering, please reach out to your providers. Thanks everyone for watching!